Tēnā koutou katoa, so Lisa Underwood. I'm Lisa Underwood. I'm a senior research fellow. I've been working at Compass since 2021, I think. I can't actually remember how many different projects I've worked on by now. Currently, I'm really privileged to be funded through a lived experience grant from Ember Innovations, Ember Wellbeing. And that's to do some work around rare disorders that Barry mentioned, partnering with Rare Disorders New Zealand. And I'm also doing a small piece of work that we talked about around whether we can obtain data on people within the IDI who are engaging in sex work. So I've kind of ended up doing lots of projects around small groups of people, which is really, as I think Barry kind of alluded to, really fascinating when you have the whole population within the IDI to look at, to see how can we obtain data on people who are in quite unusual or stigmatizing situations to see what is happening in their lives. As well as being a researcher, I also am on the committee as a volunteer and a community organiser for Tuberous Sclerosis Complex New Zealand, which is a very, very small charity representing a rare genetic condition. TSNZ is also a member of Rare Disorders New Zealand, the Neurological Alliance of New Zealand, and an international organisation. So I'm just going to talk a bit less about what data I have and what the kind of findings we've found, and more about how can we start to work more and more strategically together as researchers and community groups. So I've kind of tried to illustrate a little bit about what I think is kind of what we should see, hopefully. And I think the key thing here is that when it comes to what needs to change and what is happening in the real world, the experts in that are people living in a particular situation. I'm probably going to talk about health conditions more because that's my area of expertise, area of specialty. But those people who are living with a health condition or supporting people with a health condition, either as a carer or as a community organisation, those are the people who really understand what life is like and what needs to change. On the other side, we have researchers like us at Compass who have some idea. Often we have our own experiences of health conditions, our own experiences of the health services, but where our area of expertise is having, well, apart from anything, we might well have data around specific health conditions or around specific groups of people within New Zealand, or about specific questions that we've asked people in surveys. And we also have that research experience. We know how to do, hopefully, really good, robust research. And because we're at the University of Auckland, we've got that infrastructure around us that makes things a lot easier for us to carry out research than it does for community organisations to carry out their own research. So I think community groups and researchers, we often have these kind of shared goals around essentially improving outcomes for people. And there's many overlaps in our knowledge and our skills. But we each have these key strengths that can be used together to make the kind of changes that both of us as groups of people working in the community or in academia want to see. So I've kind of put what I think are some of the kind of changes we're trying to make, both as community groups and as researchers, ultimately leading to improved outcomes. And on the right, I've given some of the key areas that I think work best when key stakeholders work together. So I do realise I've not included all of the stakeholders in this cog or this machine. There are also clinicians. There are people working in the policy space. But because we're kind of researchers and we've invited you as community groups here, I've just focused on those two. And I think really what we need to do is quite strategically kind of tackle these issues. What are priority outcomes? So when we think about people with MS, what is important for people with MS that we should be looking at in terms of their long-term health and well-being? Is it about being able to access specific drug treatments? Is it about being able to access home support? Different people will have different priorities for themselves, but we'll probably see patterns among groups about what are really the key things that we should be trying to change for people. There are lots of barriers to kind of achieving the end point, the improved outcomes. We need to understand those barriers. Why isn't informed and robust evidence being produced? If it is being produced, why is it not being used by policymakers to inform policy and practice? And we really need to be quite strategic about this, developing new strategies for change. And ultimately, I think conducting research together rather than doing it in silos and only coming together at certain points of the research process, probably need to be enmeshing what we do more successfully. But the big question is, how on earth do we do this? And I do not have the answers to that, but I thought I would kind of go through some examples of how we've done that recently at Compass. So it's probably only something we've started thinking about more systematically, I guess, or more strategically recently. It has definitely happened more by, I guess, accident or more through connections, less through, I guess, design in the past. So just a few projects from the last, 2 or 3 years. As Barry has said, we mainly do these research projects that are around integrated data, around surveys. We've started doing a bit more around data source reviews. So that's working out what data is there in the world, or in New Zealand anyway, around specific conditions. Because before we can start doing research in the IDI or anywhere else, we need to know what is available to us. It's not always that obvious. I'll go through an example. And yeah, just some of the very diverse groups of people that we've worked with over the last couple of years. And these groups have come in and out of these projects at very different stages. So in some cases, it's right from the beginning. And we've partnered with organisations for funding applications, and when we get our ethics and data access applications. In some cases, it's when we've already got the data, we've got the funding, we've got the data, and we kind of want to know, we kind of want to get some feedback, I guess, on what we're seeing to understand it better. And also to just provide that information back to community groups, which is one of the key things that I really love doing. Anyone who's heard me present before knows that I love data, and I love making graphs and showing people data. And what I really love is when you get together with community groups or clinicians or any other group of people and show them the data, and they get so enthusiastic about it, they get really excited about it. And in some cases, they didn't even know they wanted that. So with the project that we're working on with the University of Cincinnati on sex worker health, we got in touch with the NZPC, the Altera Sex Worker Collective, and said, we're doing this project and we've kind of got some data and we're not really sure what to make of it. Can we show it to you and see what you think? And they were like, oh, okay. They had no idea this project was already going on. I think we partnered with them for the ethics application, I think. But they didn't know anything about the integrated data infrastructure. But as soon as you started talking to them about, we've been able to identify, a cohort of people who said they were engaging in sex work in the census and show them some data, then the enthusiasm was, amazing about asking me questions about, well, can we do this? Can we do that? So I love that process where we start asking each other questions and developing the work further. And for us, especially when you're using the IDI, when I was doing primary research, I was visiting participants, I was talking to them, I was gathering data from them, and that gave me a good connection with them to understand what was going on in their lives. But often with the IDI, we're very far removed from real people. And so for us, making sense of that data, making it more meaningful is really important. And in terms of these groups and the type of involvement they've had with us, in some cases, we've kind of established formal, I guess, advisory teams and given people advisory roles that we've included in funding applications. We might have been partners in funding applications, so submitting applications together. So the Rare Disorders project, Rare Disorders New Zealand, were very much a kind of big part of my funding application for that, or they might be funding the research itself, which is what's happened with Natalia's work. So I thought I'd go through a couple of key examples of where we've been able to work pretty closely with community organisations, but in quite different ways and for quite different types of projects. So last year, around this time last year, we were approached by Ministry of Social Development, because as you know, the carers strategy is well overdue to be for a new strategic plan to be developed. And they wanted to know what data are there in New Zealand on carers. We'd previously done a data source review around elder abuse, which they, again, was the first time we'd really done that quite more systematically, and they found that really useful. They used that to then fund further research on the prevalence of elder abuse. So they wanted to know, their feeling was that we don't know anything about carers from a quantitative point of view in New Zealand, and was that because there's no data? And so really was to inform the carer strategy, find, can we do research before we even start trying to actually do the research? Let's figure out whether we can. So can we find data on carers? And some of the barriers, I think, for people like, this was mainly for the MSD, but Carers New Zealand, stroke the Carers Alliance, very much a key stakeholder in this. One of the issues they have is when they're trying to, get funding for services, trying to provide services, trying to understand what's happening. They run surveys themselves, but it's getting increasingly hard to get people to respond to surveys. And we don't always have that. Those survey respondents are not always representative of the broader population. But they had no idea, what data are there, what data are available. And it turned out actually surprisingly a lot. We actually found a really broad range of data sources that include information on carers, the people they're caring for. It's quite, they're quite kind of small pockets of information, and there's some limitations around them. But there's a huge amount, not huge amount, but there's quite a significant amount of data that hasn't been analysed. It's just sitting there. It's been collected, or it's available through administrative data sets, but it hasn't actually been utilised. So I think that's one of the key things that we found in this project. And so generally, the Carers Alliance and Carers New Zealand, they mainly were kind of engaging with us via MSD, which I think is not how I would prefer to do it, but that was the easiest way for this to work because they are a key stakeholder in the carer strategy, which is led by MSD. But it was really useful for them to feed back to us. They gave us really amazing feedback on some of the methodologies. When we were writing the report, they came back to us with really fantastic feedback from their perspective of what's going on in terms of the state of carers data. We're really hoping to publish that report, and I think that's something that we would want to make sure that Carers New Zealand Carers Alliance had access to the findings from that report. I'm going to talk about this one next because it's very much related but sprang from a completely different project. So when we were doing the Life Course project, we were looking at individuals who are living in families that are affected by long-term health conditions. We realised that there's questions in the census that relate to caring for other people with health condition or an illness, either in your own household or as part of another household. This is in the section on unpaid activities, so whether you look after a child in another household or your own. And we realised that nobody had really looked at this data. It has been looked at to some extent, but nobody had really looked at it from the perspective of younger people. So I think we reached out to Lauren Donnan, who is did her PhD around young carers, was involved in Young Carers Alliance. And through her, we became connected to Unseen Heroes. They're a charity that runs support groups and camps for people who are young carers. And one of the issues we realised for them is when they go to get very small amounts of funding from, say, regional councils, what's happening is the regional council is coming back and saying, well, how many young carers are in this area? And of course, Unseen Heroes have no way of being able to find that out, nor should they be, quite frankly. But we realised actually we've got some of this data and we can work with this data. So what we've been doing now, I've got a couple of master's students. We're producing a nice shiny app. So young Unseen Heroes or anybody else who might be working with young carers can go into this app and click on a region of New Zealand and see how many young carers, according to the last census, live in this area. How many are male, how many are female, and we're just expanding that to look at ethnicity. And actually the previous project, the data source review, has fed into this as well, because we realised that actually there's quite a few pockets of data sources on young carers that simply have not been used. So census carers data is from age 15 and over, but in terms of that under 15 age group, where it's much harder to obtain data, there are data out there from growing up in New Zealand, which has been analysed but not published by MSD, from the youth series, from MSD's youth wellbeing survey. There are data there, but nobody's using it. So we've kind of been trying to get that information out there and encourage people. You know, they have students to have them analyse this data. And then I guess the most recent project, and this is a kind of watch this space. So I think this really came about because of my role with TSC NZ. So because I'm the community organiser, I'm now TSC NZ's representative for meetings that that the Neurological Alliance have every 2 months. 2 months. And it was clear among the organisations within the Neurological Alliance that a lack of evidence, a lack of data on what's happening for people with neurological conditions in New Zealand is a problem. It's difficulty providing evidence to government that we need more of a strategic approach to neurological conditions. And we knew that in the UK, they have been carrying out surveys for at least 10 years, I think. And they've been able to get really good and important data from the UK about how many people are experiencing mental health difficulties because of their neurological condition. And yet how few people are asked about their mental health or their mental well-being by their clinicians. So really, yeah, in terms of looking at neurological conditions as a big group, this hasn't really been done very much. And then I was kind of saying, well, if you want to do a survey, I work at Compass Research Centre and we do surveys. So this is very much from the beginning, working through what research we would actually do. And we are waiting on two grant applications, one to Auckland Medical Research Foundation, one to Neurological Foundation. Firstly, to do a data source review. So what data are there? Not just in administrative data, but some of the big surveys might include information on people with neurological conditions. And then to run a survey of people with neurological conditions in New Zealand. And to do that in a very, robust and methodological way. So the UK Neurological Alliance has gifted us with survey questions. But as soon as we looked, then we realised we're going to need to do a lot of adaptation. A lot of the health kind of service terminology doesn't match with New Zealand. A lot of the other, we need some work around what's important for different groups within New Zealand. So that's going to be sort of a year. And the idea is we're going to take a good long time. We've got an amazing team of advisors from representing clinicians, young people with neurological conditions, carers for people with neurological conditions. We've gone all out to make this as a kind of involving as many of the important stakeholders as we can. At Compass, we kind of don't see, I guess, what maybe community groups see as much. I think because because our work tends to be around population data, integrated data. I think when it comes to what researchers want from community organisations, in general, if you're a community organisation and a researcher contacts you, they want you for participant recruitment, isn't that the main? They either want you to send a survey out to your members, or they want you to actively recruit participants, maybe for a clinical trial, maybe for a focus group or a survey. To me, that's not really engagement unless you've already been involved from the very beginning of that project. So if somebody's coming to you and saying, you know, if it's very directly relevant to your community group, so for example, if someone with research came to us at TSCNZ and said, we want to do a survey of people with tuberous sclerosis, I'd be saying, well, we haven't seen this survey, we haven't been involved in this from the beginning, this is not, you know, not really going to work for us. So I think you really, as a community group, it's really important to think about what is it that the researcher wants from you, and what is it, to what extent are they actually engaging with you? Are you going to be in an advisory role? Are you going to be in a partnership? Will you be able to co-design interventions or co-design projects, which is kind of where you more want to be, except that it is timely. It takes time and resources, and often that won't be built into a researcher's funding. It should absolutely, any time a community organisation is carrying out work for a research organisation, even if it's just sending out emails, there should be some way that community group is, you know, being compensated, because that doesn't happen by magic. Somebody has to spend that time, which if you're a volunteer organisation, that's taking time away from something else more directly related to your community. So thinking about, if you want to get involved with research as a community organisation, I think it's really important to have a plan at your AGM or at your board meeting. You know, how are you going to engage with research if you don't already? I think smaller groups, this is harder to kind of build in because you're perhaps not used to it, but, you know, do you have a key contact person? Have a clear idea of your capacity. Really consider policies around engagement. So at TSCNZ, we've got specific policy. It's mainly around accepting funding from pharmaceutical companies, but you might want to consider, if you're approached by a researcher, do their researchers have values that match your own? Because that's not always the case. And it's really important to kind of do your research, I guess. What has this person already published about the community that you're representing? And is it fair and is it ethical? If you're interested in getting involved with research, the hardest part is getting involved with research before it happens, right? Because you don't know what's going on. But if you see there's someone, particularly in New Zealand, who's publishing a lot about, you know, the community that you represent, then just get in contact with them and say, what have you got? Do you got any data for me? You got any new projects we can be involved with? Really important. The thing that is a real issue and a real gap actually is that researchers should be including budget for engaging with community organisations, but we don't have any funding to support developing grant applications at all. We tend to do that actually pretty much in our spare time. We're not really funded to do that, and therefore we also don't have funding to support community engagement. So there's a real mismatch there. And I know for Natalia, she finds it really hard to kind of ask people to do things for free. It is really hard and it shouldn't happen. But if we want to submit a grant application, we need to do some work in advance. So it's important to consider how you might be able to facilitate that. Just give some resources that we have at Compass. If you wanted to check out our new website, is kind of ready.
Close to.
It's close to ready. It's revamped. It's got lots of good ways to search stuff. We've got all our projects listed there. And I think as well, yeah, thinking about those short courses that we do as well, some of those would be really useful, I think, for community groups, the stuff around qualitative research and analysing that. Yeah, that's me. Thank you very much.